Hello and welcome. This is Health Review and I am Chika Onyesi. Thanks for joining us again today on the show. Okay, today is World Blood Donor Day. The day is established by the United Nations to encourage persons to donate blood to help save lives in case of emergencies. So we would like you to walk into any blood donation center and donate blood to save a life. We dedicate this episode of the show to all those who constantly donate their blood to save the life of others. Okay? We will like you to be part of this program, so please join the conversation on Twitter at Health Review STV and send your contributions to our Facebook page at Health Review on STV. Thanks for joining us again on the program. Our focus on the show today is improving the quality of healthcare through effective medical commodity supply management. Oftentimes, we hear that hospitals have run out of essential medical supplies and consumables. Sometimes patients are advised to get their drugs from pharmacies outside the hospital because the hospital has none in stock. Most of these incidents are not as a result of unavailability of commodities, but inability to manage what has been provided. Well, we'll come back with detailed explanation on the context of supply management that we'll be discussing today on the show. For now, let's take a few health stories from the global health scene. Blood transfusion is estimated to save about 75% lives during emergencies, but the WHO says many patients requiring transfusion do not have access to safe blood. They have recommended that providing safe and adequate blood should be an integral part of every country's national healthcare policy and infrastructure. The WHO also recommends that all activities related to blood collection, testing, processing, storage and distribution be coordinated at the national level through effective organization and integrated blood supply network. A global study says you do not have to be diagnosed as obese to be at risk of dying from illnesses related to excess weight. Of the 4 million deaths attributed to overweight in 2015, nearly 40% were not considered clinically obese. The study found more than 2 billion children and adults suffered from health problems linked to obesity, linked to being overweight, even with a body mass index less than 30, the threshold for obesity. Okay, moving on now, we will take a short break. When we return, there will be more to come. Don't go anywhere.
Silverbird Television.
The point is this: is the executive branch. The president has
me, Segun Ojomo. On this program, we'll be bringing you news, views, and exclusive interviews.
Not political will to bring back people, our medical experts that are on that.
praised the efforts so far.
The synergy that has been developed.
Arrived Abuja from Washington, D.C., where he joined President Barack Obama.
The cause of the economic recession was over. Now, Senator Saki in an interactive
to capture the moment for in-house in session.
With the powers that be.
Welcome back. You're on to Health Review. Like I said earlier, it is the World Blood Donor Day. The theme for this year's celebration is "Don't wait until disaster strikes. What can you do? Give blood, give now, give often." My guest and I are, until he's unveiled, you will not see him. My guest and I are wearing red to, signify the World Blood Donation Day, so that we'll help encourage others to donate blood. Okay, here is a report that to help you understand the need for you to donate blood. The report, please. The Federal Ministry of Health had estimated that the blood need of the Nigerian blood banks stand at 1.4 million to 1.7 million units per annum. Unfortunately, within the past decade, much less has been collected nationally, leading to avoidable deaths and morbidity. But hopefully, this trend may change in the near future as we see a new crop of young Nigerians troop into the center to donate voluntarily.
If we don't have money to give in terms of money, we don't have anything to give in terms of money, we have some natural things to give that God gave us free, which is even more precious than money at times.
These days, at least every day, we have up to 10 people that walked in here to donate blood voluntarily.
About 20 years ago, I had an accident, and were it not for the blood that was given, donated blood that was given to me, I would have been dead.
What we've done here is to exhibit that it is real. We need to do it to save lives.
The National Blood Transfusion Center says the blood bank could grow if only about 1% of Nigeria's adult population commit to voluntary donation. But there are also those who think blood donation is a money-making venture.
Those that come here to donate blood know that they are giving it free. But we still have few people that want money. But by the time we cancel them, will they change their mind and they donate voluntarily?
As far as rules of humanitarian service engagement goes, everyone must do all within their power to contribute to the society. So, irrespective of your class or financial status, there is something you can do to contribute to Nigeria. Donate blood today and save a soul. Welcome back to the program. That report was played to, stir your conscience to want to donate blood and save the lives of those at risk, especially at emergencies. Back to the topic of today, we are here with Dr. Laz Ude Eze. Dr. Laz is a public health analyst. He is a public health analyst and a regular guest on the show. So we would like to, Dr. Laz, to talk to us about supply chain management. But first of all, we want to know the aim of creating healthcare delivery structures is to ensure that healthcare gets to those who need it. Now, to improve healthcare delivery, the medical supply chain must be seen to be effective. But its effectiveness is dependent on the knowledge of healthcare workers, the availability of drugs or care commodities, management and supervision of healthcare facilities. These issues are issues that hamper effective supply chain management in Nigerian healthcare delivery system. But today we want Dr. Laz to help us analyze these issues and give us a view on what the status quo should be. Dr. Laz, you're welcome to the program.
Thank you, Chika.
Okay, first of all, we want to know what exactly is supply chain management, commodities supply chain management.
That's really good. In your introduction, you captured the very key components of the supply chain management. It's simply all about how drugs, reagents used in the lab, and equipment used in the hospitals, how they move from the point of production to the point where they are used to provide healthcare for clients.
Okay.
So any of those things that are used in the hospitals that need to be available, especially the ones that are utilized on daily basis, how they move from the production point to the hospitals or health centers or clinics or maternities, whatever name is called, where it's utilized. Okay. So, and a whole lot of things are involved in ensuring that we get those things arrived there. There are, like the rights of commodity management, things that must be right, R-I-G-H-T. So one, the product have to be right. It has to be the right product. So which means fake products are not acceptable.
Part of the supply chain.
Yes, it begins from the commodity itself. So when we say commodity, especially in the health supply chain management, we mean drugs, we mean reagents that are used, we mean the syringes, you know,
gloves, face masks,
yes,
and all
they are
those.
called consumables and all that, but the general name is commodities. These things need to be available. So from the point of production, it have to be the right product. So which means it shouldn't be faked. And also it has to be the right quantity as at the point is leaving that point of production. So how do you know the quantity that is required? Say, for instance, we have the University of Abuja Teaching Hospital. So, and that's like the tertiary hospital, the health institution in Abuja. It gets referrals from Kogi, gets from Niger, gets from FCT and Environ. So, and let's take, for instance, a particular commodity. Which one is most commonly, okay, we're in the rainy season, rain falls, and you have people are having cough and catarrh and other cold medications, or maybe people are getting fever, having malaria and all that. So let's take anti-malaria drug, artemisinin combination therapy, for instance. And you say for a particular age group, because you know that the drug, you also have different doses for different age groups. So let's take for children under 5 years, you have the age group of under 1, and you know we have like 2 drugs that service those within that age group. So you want to know what quantity is utilized, say, every month. So, and you know, in the hospital you take records. So through those records you will know that, okay, say every month you utilize 100 of that average, you know. So if you utilize 100 of it, it means that it must be available at each point. You must have at least 100 to last for at least a month.
Okay, doctor. Before you go further, I would like us to even establish the Nigerian situation. Yes. Exactly how, what is the state of the Nigerian health medical supply chain? How healthy is it? How bad is it?
Your guess is as good as mine.
Okay.
And that's of the listeners as well, because generally speaking, our healthcare system is not at a state that is at the right state. You know, is not at the right state. So, and that's why every effort is being made to make it stronger. So, and the medical products and the supply chain is one of the pillars, one of the building blocks of the health system. Take it away, nothing. Of course, there are other things, but just take it away, you cannot have good quality healthcare delivery. So it's suboptimal. Like you mentioned in the introduction, you have stockouts every now and then. You go to the hospital to receive care, they will tell you buy this, you go and buy and come back, they will send you to go and buy something else. So you keep going.
And incidentally, you're the sick one, you're not supposed to be.
Yes,
you know.
Sometimes it's your relatives or whoever, that your caregivers that take persons there. They will, you know, sometimes you have just to pity people, the way they are walking in and out. They will buy gloves, they will buy syringes, and when prescription is finally made, you go to the hospital pharmacy. If you have 5 on the list, okay, you have this, you have that, we don't have this, you start looking elsewhere.
Running around,
and it involves costs. So you are paying out of pocket for services, you are paying out of pocket to enter transport to wherever you are going to get it. And those things put together are things that affect the quality of care.
It surprises me to think that somebody who is scheduled for surgery. There are surgeries that are emergencies. There are surgeries that are scheduled. I mean, you pay beforehand. It amazes me that somebody who's scheduled for a surgery comes to the hospital and they say there is no face mask, there is no gloves. I mean, these are the tiniest of things that you should not have not available in hospitals. How is this possible? At this point, whose fault is it that these commodities are not available for perfect healthcare delivery?
Yes, there are a number of persons that play in the system. If you look at the hospital setting, for instance, you have the administration, because you have to talk about the leadership. Yeah. So one very important factor is the leadership. So at the hospital, you have the medical director, you have the director of pharmaceutical services, who is a pharmacist. You know, so the director of pharmaceutical services is in charge of, you know, managing the logistics, the supply, procurement and supply management within that hospital. So, and there are forms that you feel that within the store, they have various tools we call LMIS, Logistic Management Information System. Those tools are registers. When commodities come in, you count the number, you put it in there. Whenever it's taken out from the store to the point at which it's dispensed, because apart from the points where you see pharmacists giving it out, you have a store where they are kept in the right condition. So when it gets to a certain point, you are supposed to make an order. So at that point, you are supposed to make an order. If, for instance, the commodity is supplied bi-monthly, every 2 months. So at any point is used up to that level, you are supposed to make an order. So, and when you make the order, it's expected that before it finishes, a new supply should have been made, so that you have a continuous flow. So if the record is inaccurate, if you are not keeping accurate records, it means that you may either make the order earlier than when you are supposed to make it, or you make it later than when you're supposed to make it.
Okay. How does managing these commodities affect its availability? Do these two things correlate, management and availability? Because apparently the recording system that you've just mentioned is a way to manage what comes in and what leaves.
Yes.
But if we have a problem with that, does it affect availability of these commodities?
It could affect availability, but it's not the only factor that affects availability.
Okay.
For instance, many of these commodities are produced outside the country.
Oh.
So it takes time for it to move from the point of production to even get to Nigeria. Take, for instance, all the drugs that are used for HIV treatment. So they are largely not produced in the country.
Yeah.
So, and it's a huge problem. So when those medications are to move from wherever it's produced outside the country, it stays on time. If there is any delay, it has to be cleared as well at the ports. So custom people are key people involved in logistics management system. When you go to a hospital and you get poor quality of care or you find things not available, you usually point fingers at the people you see around.
Yeah.
But there are many players outside the hospital system that play key role. People at the ministry as well. If the country is to procure somebody, a file is waiting on his or her table.
Somebody has not
to
signed the bureaucracy.
Yes, bureaucracy for the process to start. It causes delay. There are sometimes you have certain medications completely out of stock in Nigeria. It's unbelievable.
And they are not over-the-counter drugs.
They are not over-the-counter drugs, so you have them completely out of stock in the country. And you have people making phone calls, those that are privileged to have friends and relatives outside the country to buy and send to them. And that's talking about availability. So if we are having local production of most of our most important, in fact, all of them, but starting from somewhere, the very important medical commodities, it will be helpful. And that's why a lot of Nigerians are very excited with the recent concessioning of the vaccine production
in Nigeria
that the Federal Ministry of Health had with May and Baker, to commence local production, because meningitis broke out and we didn't have vaccines to give out to people because they are not produced here. And those who are producing were telling us that they didn't have adequate quantity
to supply.
So if they release all the quantity that is available to them, to Nigeria, it's not even going to be enough compared to what we need
to solve our problems. Okay,
yes.
So, doctor, sometimes we argue that funding is a problem that healthcare delivery has in Nigeria. But in this case, when these drugs are provided, some of them end up not getting to the point where it is needed. Can you blame funding for this too?
Well, funding is a challenge on its own, but it's not the only problem. Because money is not going to move the vehicles, money is not going to write it, so it's a key component, because if you don't have sufficient funds to manage the entire system, there will be gaps, even when every other part is functioning very well. So, but the question now is the one we have available, because human ones are unlimited, so we may never have all the funds that we need. So, but the ones we have, how are we managing it? So, if we are managing it well, everybody does their job. That's accountability. We hold each other accountable. Let the customs person do their job well and clear goods on time, so that we don't have our medical commodities being at the port for a very long time, at least for now that we are still doing a lot of importation. But talking sustainability is what should continue to happen. We need to support our local industries. And I think the Federal Ministry of Health have started doing that, working closely with local manufacturers. A number of them need WHO certification to be able to produce certain commodities for it to be used. So I don't think most of our pharmaceutical companies don't have that WHO certification to produce many of, for instance, the vaccines we are talking about, even like HIV drugs and so many of them.
Okay, you mentioned HIV drugs several times. Yeah, sometime earlier this year, the minister lamented that HIV drugs worth 1.8 billion naira expired in the store.
Yes.
Now, we are wondering, and then you have persons living with HIV and AIDS protesting all over in the streets, complaining that they do not have access to antiretrovirals, and that has increased the spread of HIV, that has increased the death rate, the mortality rate of HIV. Now, we are wondering, what are the drugs doing in the store? when they could be given to these people. Whose fault is it at this point that is it a problem in the supply chain management that drugs bought for use are left in the stores to expire?
Absolutely. It's a perfect example of what could happen when the supply chain management system is faulty or is not performing optimally. So because now we talked about the delay that could happen at the port, it has gotten to a store. Then it's supposed to move from that store to like the national store, for instance. You also have stores at the state level. So it's supposed to move from the national central medical store to the state medical stores as well. And it's also supposed to move from the state stores to the health facilities where they are dispensed. So if there is no such movement from the store and you go to the facilities, they are saying this is out of stock. And in the stores, they are there. So someone needs to move it. One interesting thing is we get many of these HIV drugs from donor support. So it gets to that place. Then if the donors don't provide money for it to move from the store to the health facilities, it remains at the store.
I mean, they give us mats and teach us how to sleep on the mats.
That's one of the challenges. And in fact, it's not just at the national level, even at the state level. If, for instance, now you, Ochika, out of your benevolence, now decide to donate, say, paracetamol to the state, to a particular state, and you donate large quantity of it, it might just be taken to the state store.
And left in the store.
Require, because funding at that level, with due respect to a lot of state governors, but a good number of them do not quite fund health.
Okay.
So they will not release resources that could move it from the store to the facilities
where they are needed.
What will happen after some time, people that have access to the state store will start taking from it to sell and to do all sorts of things.
Doctor, we've outlined the problems. What solutions can we give to the supply chain problem that we have in Nigeria? Managing what is available and making sure it gets to those who need it. Briefly, sir.
Okay, the solutions are many, but we need to first start from political will.
Okay.
So we need to have the will to make the health system work. So, and with that will, we will now ask question, what needs to be done? Leadership. We need a strong leader, not just strong, appropriate, knowledgeable one. Sometimes we assume that people in leadership position know what to do. It's not right in all cases. So you need to get experts who are going to, train people. Some have been trained, some may not, so every leader that is involved should have the knowledge first. Even if there is no money for formal training, people can utilize resources, learn, read and learn and know the right thing to do. Then coordination, we need to coordinate our efforts. So now we have in the health sector a lot of authorities and, donors are doing their thing, some people are doing their thing. So there's been a program to say, okay, let's have integrated system so that everything works together. So that coordination is important. Accountability. We need to hold people accountable at various levels.
Like those who left 1.8 billion naira drugs to expire.
Yes, that accountability. And interestingly, this conversation is ongoing as we speak. On the African Healthcare Delivery Conference here in Abuja, and everybody in the continent, experts are talking about this.
Okay, those who allowed our drugs to expire in the stores, they need to be brought to book. They have to be accountable. Drugs must leave the stores and get to the point where they are needed. This is what we've been discussing on the show today, and we have been speaking with Dr. Laz Udeze. He is a development expert and a public health analyst. And we have been talking about medical supply chain management and how hospitals can judiciously handle what commodities are available. Okay, this has been our package for today on the show. Please do join us again next week. And remember, it's World Blood Donors Day. Please look for a blood donation center and do your part. Thanks for watching. Bye-bye.